In this podcast, we introduce Chapter 7 and the idea of patient assessment. In particular, we're going to look at the first part of patient assessment. We're going to look at the scene size-up that occurs. So pay attention to the key terms here: general impression, mechanism of injury or MOI, and nature of illness, NOI. We'll also discuss the first thing, protecting yourself with scene safety, as part of our scene size-up. The overall patient assessment consists of 5 parts that we work through in a very systematic and methodical approach for every patient that we come upon. We're going to focus in this video on the scene size-up, and in future videos on the primary assessment, patient history, secondary assessment, and reassessment. For scene size-up, there are a few things we need to ensure. It's the first step of patient assessment, and a nice way to summarize it is to protect yourself. We begin with scene safety. Now, for scene safety, we need to ensure that the patient does not become further injured, or that we ourselves don't become a patient. We see this patroller moving uphill and crossing skis above the injured patient. Part of that scene size up is just a broad 30,000-foot view of the area to establish what might need to be done. And for scene safety, it could be a downed electrical wire. It could be snowmaking equipment. If it's on a bike trail or in a terrain park, it's making sure that skiers or riders above you don't enter the scene and endanger you. Always mitigate those dangers before beginning treatment. Now, part of scene size-up then moves to determining how many patients you have and the mechanism of injury or nature of illness. So a mechanism of injury might be, as we see here, the possibility of a tree strike just because the patient is off to the side of the trail in an area where the snow isn't groomed and she's near those obstacles. Make sure that then you further protect yourself, not just with scene safety and marking the scene or ensuring that the visible hazards are taken care of, but make sure that you initiate standard precautions, BSI, body substance isolation. Go ahead and don your gloves and any other protective equipment such as goggles or safety glasses. You probably then want to consider the additional resources, maybe with a quick radio call. That could be extrication equipment or additional hands if that's required, but that's what we're going to consider in the final step. Scene size-up is one of 5 pieces of a full patient assessment, and it has its own steps. Making sure that the scene is safe, rapidly scanning to determine NOI or NOI, protecting yourself with BSI, determining the number of patients and considering additional resources if there is more than one patient or it's a difficult patient in terms of the treatment required or extrication.